Welcome to this edition of Labor Vision. I'm Bob Delaney, Executive Director of the Institute for Labor Studies and Research. Labor Vision, a production of the Institute, focuses on topics of importance to working Rhode Island families. We hope you enjoy this evening's edition. Welcome to this edition of Labor Vision. I'm your host, Bob Delaney. Public school education has been the equalizer, the leveler, if you will, for individuals to be able to get a quality education, graduate, and move on to post-secondary training or certificate programs and to employment. In those schools, it takes a whole array of people to provide that kind of quality education. Education that is more and more on a daily basis being individualized to the student in the classroom. That only takes place because there's a whole team of people, from the principal to the guidance counselor, to the nurse teacher, to the TA, to the support staff in the school, to the librarian, and it goes on and on. There is a lot of dedication on the part of many people to ensure that we can provide quality education in our public schools in Rhode Island. For the last 6 years, the Institute for Labor Studies and Research has been offering a program for teacher assistants. And we all know how important that contact is in the classroom with the teacher and the teacher assistant. I'm very pleased this evening to be able to have a conversation with the two people that run our teacher assistant training program at the Institute. Sylvia Melgar is the program coordinator. She's the person who receives the calls, coordinates all the information. Audrey Hirsch is the individual who has really from the very beginning pulled together the training program in collaboration with the Rhode Island Federation of Teachers, teachers in the Cranston School Department. And for the last 6 years, we've been very fortunate to have her lead this team of instructors to ensure that we can offer a quality program. Ladies, thank you so much for not just being here today, but for your years of commitment to a program that really does make a difference with students and even more importantly, makes a difference with the people who come to the classes that you offer. I want to start with you, Sylvia. We know that we have a class coming up fairly quickly.
Yep.
What are the dates?
February 27th to March 22nd.
And people are currently enrolling?
Yep, I've been having people coming in, taking their pre-tests, and just getting them set up for what they need for the class.
And I think it's important when you talk about the pretest because there are some definite skills in terms of reading levels and math levels that are required. But we're able to determine that by either doing the assessment, but at the same time, I think you have to have a high school graduation certificate?
Yes.
What about the people who come in and maybe have an associate's or a bachelor's degree?
Through RIDE, they're not required to take the Parapro assessment. They have to do the first 2 weeks of the teacher assistant course, their 3-hour job shadowing, and they are not required to take the Parapro assessment.
So the Parapro assessment is a determination, I believe, at the end of the program about their English and math skills and their ability to be able to effectively communicate and work with those students. Mm-hmm. Let me come back over to you, Audrey, because you were instrumental in designing the curriculum. I think that you and the Federation of Teachers and John Santangelo and Rhonda and a whole variety of other people really sat together 6 years ago and created a curriculum that we know works in the classroom every day.
That's right.
Tell me about what are the components of the curriculum? What can they expect to go through in that period of training?
Well, the 4 classes that I actually teach, we teach a lot of the role of the teacher assistant, what is expected of them, the collaboration with the teachers, the principal, all of the support staff in the school. Then we do a full night on managing antisocial behavior, because the reality of it is that a lot of the teacher assistant's job is managing behaviors and classroom management, and we do devote a lot of time to that. We have a good part of the curriculum is on the acting out cycle, which is a AFT, American Federation of Teachers course that I was trained in. We talk about the bullying and various aspects of managing these behaviors. One night we have a school nurse teacher come in, and she does a full evening of allergies and EpiPen training, proper movement and body functioning skills so that you're not improperly moving, because when you're chasing kids or restraining kids, there are proper ways so that you don't get hurt and the student doesn't get hurt. And another thing is we talk about resumes and how to go about looking for a job when the course is finished.
It's interesting because there are teacher assistants who work with teachers everywhere from elementary school through graduation in high school.
Actually up to 21 years old, because there are programs for most special ed children are covered by the school department until they're 21. So there's a 18 to 21-year-old program where they're transitioning to the outside world.
And I know from having been in the classroom watching the instruction, you're very candid to the individuals who enroll in the program and say, let me explain to you what your job is really going to be. Because you really did talk about issues of behavior and restraint and concern. And the students in the classroom have a wide variety of needs that need to be addressed by the teacher and the teacher assistant in the classroom.
Absolutely.
So is there a big difference in the personality, the skills required from an elementary school teacher to elementary school TA to a high school TA?
It depends on what your level. If you're in a severe and profound, with the younger kids, you're toileting. There's bodily fluids, and Darlene, the nurse, does talk about universal health precautions because you're exposed to that quite a bit. There are high school students who are immobile, wheelchair bound, and you never know what you're going to get. In the high school, you may be doing a calculus class. You may have, say, an Asperger's student, very bright, but needs that one-on-one attention from an adult, but they're high-level courses. So you're going anywhere from pre-K, totally nonverbal children, to very bright people, students or adults that really need your help.
And I think it's really important when you're in the classroom, you're so very candid about explaining to people what it is they can expect in all of these situations, that from day to day, something could happen that they would never expect to happen. But I think it's so important to recognize that I think being a teacher assistant or being a teacher after having spent 20 years in the classroom, it takes a very special person. I think it does. I think it takes a talented, patient, understanding, caring individual to be able to deliver programs to a class and to every student in that room. How do you know the right person when you're training them?
My biggest focus, and the word I use a lot, is flexibility. You have to have that flexibility to just go with the flow. Things change, somebody can be as calm as can be, and then something sets them off. And you have to be on your toes to just really catch it and de-escalate. Mm-hmm. The goal is to de-escalate the behaviors before the child goes off. And then if they go off, then you have to really know how to get it bring it back.
One of the other topics that we talk about are who are the people who apply. And over the years, we have seen individuals who they believe they want to teach. This is their pathway to becoming a teacher. Individuals could say, I want to try being a TA. I'd like to transfer that to a college degree and become a teacher. But Sylvia, let me go over to you. How many people that come in are individuals who, many of them seem to be mothers who may have an associate's degree or a bachelor's degree, were staying at home, going to their child's school. Child went to school, they got a little older, they thought, this is something I want to do, and a TA became the certification for them to begin to continue the relationship with a school, with the school where their child was, or to create a pathway to becoming a teacher. How many people come in with a degree?
I would say at least more than half. About that in a class, it could be either, we'll say about 15 people, and probably more than half of them will have degrees.
Audrey, how many of them are, from your experience, people who were mothers who participated in the school and now this became a pathway?
Many do that. That's how I started. I was volunteering and spending so much time, and I said, actually my kid's principal said, why don't you just take the course? You have the degree and do it and get paid. It's a great, summer's off, it's a great school schedule, benefits are great, pay's not, but it's a feel-good thing.
Well, I think that we've been very lucky in the last 6 years because I think that we have been able to contribute to a lot of people to get that certification. But as the program went on, I think that we've really tried to continue to grow the intent of that program by looking at how can we help these individuals get a job. I know when we first started with the Cranston School Department, you had a relationship with them, you told them there were people available, they would call, your students would get interviews, you helped to coordinate the interview.
Right.
I think we're going one step further now, taking a look at what we could do to expand what you started. Sylvia, what is it we're planning on taking a look at?
I have been working with our program director, and we've just been trying to kind of see where we can go with the whole job development and helping people, making their resumes, filling out job applications, what districts they would want to be working in, what level they would feel comfortable in. Desiree has been kind of taking on that part in terms of, again, having a communication with them and just trying to get them to apply for jobs.
I know that we've been really trying to expand our relationship with other school departments. We've been carrying on discussions with Local 1033, Labor's Local 1033, who represent teacher assistants in Providence. And so in reality, what part of this whole process of giving the information to the general public is really about saying there are jobs out there.
Oh.
There in this state, we are probably talking 150 available jobs tomorrow.
Huge need.
And it is a wonderful career path. It is a wonderful career. It is for the right person. And we're really, with the next class coming up, I think we have some available seats.
Yes,
and I'm hoping that individuals who think that they might be interested in doing this would call Sylvia at the Institute. Audrey, I think that the program that you have designed is one that really engages those people and really encourages them. Our dropout rate is negligible.
Very, yeah.
And I think that's a testament to the instructors, it's a testament to your dedication and Sylvia in staying in contact with them, and now in continuing to provide a kind of a job development component to it. We're looking forward to enhancing the program so much more. As we come to the end of this interview, Sylvia, just what were the dates again for the next class?
February 27th to March 22nd.
And Audrey, just as a kind of a closeout, how many weeks? What are the contents
4
again?
weeks, Tuesdays and Thursdays from 6 to 9 at the Institute.
So anybody who's interested can call the Institute at 463-9900, get in contact with Sylvia. If any of the school departments are interested in finding out more, they can call the Institute as well. You'll probably see Audrey in the grocery store, and you can ask her for more information when you see her, or even Sylvia. Thank you, ladies, for coming this evening. I'm really looking forward to people getting more information on the Teacher Assistant Training Program at the Institute. I want to thank you both for your years of support, curriculum design, and even enhancing the program more. Thank you very much.
Thank you for having us.
Thank you.
We hope you enjoyed this segment of Labor Vision. It's our continued effort to be able to provide information as well as education programs that will give people the ability to move on to a different career, change their career, or even investigate whether or not it's something that they're interested in. I'm encouraging you to call the Institute, ask about our Teacher Assistant Training Program. I'm very pleased to be able to say to you it's a program that is highly qualified, excellent instructors, great coordination, and we look forward to hearing from you. Thank you and good evening. Welcome to this edition of Labor Vision. I'm your host, Bob Delaney. One of the biggest concerns that we hear from people when they're getting near the age of retirement are their concerns and questions about the issue of their health care when and after they retire. So we're going to dedicate this information session to that, and if necessary, we'll continue in another show. But for this segment, our guest is Bob Dumais. Bob is a principal for Legacy Benefit Advisors. His group works with retired individuals to try and help them build a foundation which will give them security in their health as they move through their retirement years. Welcome to the show, Bob.
Thank you.
One of the biggest concerns that people really have is they talk about Medicare, but they don't really understand what it is. Based upon the kind of questions that you've been given over the years and the information you have, let's describe what is Medicare.
Medicare is essentially coverage provided by the government when somebody turns 65, but it's also available if someone's got a long-term health issue. If they've been disabled for a couple of years, they're eligible for Medicare. If someone's got some kind of permanent kidney issue, they're eligible for Medicare. But Medicare is pretty broad. When people come in and say they're going on Medicare, we always kind of chuckle a little bit because it's kind of like saying I'm going to go out and buy a car. I mean, there's so many variations when you buy a car, so many brands and styles of cars, big, small, and so there's lots and lots of options. So when we're talking to people about Medicare, we ask a whole lot of questions to try to dial them into something that makes sense for them, because there's lots of options. You have original, traditional Medicare, and there you're picking components and you're building a healthcare plan. And the opposite side of that is a Med Advantage plan, where you're essentially telling the government that you've chosen not to take their health care coverage, but you've instead chosen a private insurance carrier. In Rhode Island, that's going to be United Healthcare or it's going to be Blue Cross. So you would pick from the choices they have available, and that's quite a few. Rhode Island Blue Cross has got 7, United Healthcare's got 3. But if you go that route, you pick one of those, the government, instead of providing you health coverage, they will pay a premium on your behalf to the carrier that you've selected.
Let me ask you a question. Is everybody in Rhode Island eligible for Medicare?
To be eligible for Medicare, you either have to be a U.S. citizen or be a permanent resident in this country. So you can be eligible for Medicare. It doesn't mean that we're going to buy it in the same way. In other words, traditional Medicare is made up of components. You have Part A, Part B, Part C, and Part D. Part A is the basic hospital component. In order to get Part A for free, you have to have 40 quarters. So they tie into the 40 quarters that you hear people talk about with Social Security.
So the quarters are the period in which you were employed.
Right, 40 working quarters. If you have 40 quarters, then you are eligible for Part A. In Rhode Island, you have some municipalities that don't participate with Social Security. So if someone spends their entire working career working for one of these municipalities, it's conceivable that they could reach retirement age and not have their 40 quarters. So if you don't have your quarters, that means you won't get your Part A for free. You'll have to buy it. So if you get it for free, free is great. If you have to buy it, it's over $400 a month to buy Part A. Okay?
And the coverage that you would get for $400 a month would be similar to or equal to what you would get for free had you had your 40 quarters.
Yes. Yes. Now, there's some other conditions. If you don't have your 40 quarters, but you're married and your spouse has 40 quarters, you can piggyback on your spouse. If you're not married and your ex-spouse has 40 quarters, you can still piggyback on your ex-spouse to get credit for those quarters. So once you have your Part A, the next thing you have to do is get Part B. So Part A is essentially hospital coverage. Part B is essentially medical coverage. So Part B, everybody has to buy. Part B is somewhere $130, $140 a month.
And what does that cover?
That's essentially your medical coverage. So it would cover the fee for office visits, fee for surgery, any kind of testing, MRIs, lab works, all that kind of stuff. It's all rolled up into Part B. Now, when you put A and B together, you're left with a skeleton of a healthcare plan, if you will. You have lots of deductibles, you have lots of co-pays, and you have no drug coverage yet. So to make that a comprehensive plan, you have to add Part D. Now, Part D is a drug rider. In Rhode Island right now, I believe there's 24 or 25 different Part D riders that you could pick up. So when we're meeting with people, we typically, find out what medications they're taking, what dosages, the frequency. We plug all that in, and it gives us the best Part D option for that person on that date.
So on Part D, it would vary by individual depending upon what medication you may be on for the rest of your life, what medication you can expect to be on, cold and flu season, a whole pile of factors would come into that Part D.
Right, and the best we can do is make a decision based upon that point in time. I mean, our healthcare is fragile. We could become very ill tomorrow and we were fine today. But we make the best decision for them at the time. So now you've got A and B and D, you have a drug program. You still have a lot of exposure. So now the next step is to get a supplement. In Rhode Island, there's lots of carriers that offer supplements. The government, in their infinite wisdom, actually put together 10 different supplement models. And the carriers that want to work in that space, their supplement models are dialed in. For example, Blue Cross might have a Plan F and a Plan A, and United might have an F and a D. So the carriers can choose which ones they want to fall into, and depending on which one they fall into, that determines the level of exposure that they're going to take from you.
But it's important that there's a differentiation that people hear about being Part A, Part B, Part D, and then filling those gaps with a plan. And sometimes those letters are the same, because you can have a Plan A, you had a Part A over here.
Right.
The plans fill in the gaps in the parts that you had.
Exactly.
And it's important that you recognize that you can get several of the plans from different providers, and what you do is line up the plans and compare them to the individual to ensure that they're making the best selection for them.
Exactly. And a Plan F from Blue Cross is essentially the same as a Plan F from United Healthcare or from Bankers Life, but yet the pricing can differ significantly. So United's Plan F is about $130 plus or minus. Blue Cross is about $140. A gentleman I know is on Bankers Life Plan F. He's paying about $220. So he's paying a lot more for no better coverage. And while we'd love to help this gentleman and move him into a more cost-effective Plan F, there's reasons why he can't do that. So it's not always easy to move from the plan you're on to something else.
Now, is there a time each year that people can move from one plan to a next because the prices have changed from company to company on that plan?
Yes and no. So there is an open enrollment period, which runs from October 15th through December 7th. You know when it's that time of year because the TV commercials are all from the different companies offering supplements and that. During that time frame, if you're a Rhode Island resident, you can make some changes. There are limitations on the changes that you can make. So if you're moving from so we didn't talk much about the Part C, but if you choose not to take traditional original Medicare, the other alternative that you have is you can pick a private insurance carrier instead of the government to provide your coverage. In Rhode Island, the choices you have are Blue Cross of Rhode Island or United Healthcare. Blue Cross has got 7 plans in that space. United has 3. If you decide to go that route, the coverage is very different. You're essentially telling the government that you no longer want them to provide you health insurance. You've chosen a carrier and you've chosen a plan, and you would like the government, instead of giving you coverage, to pay a premium to the carrier you've chosen to offset the cost of the plan you've chosen there.
So your development of quarters, which would make you eligible for Medicare, you make the decision that you don't want to be in the Medicare program, that you're going to ask those contributions be made on your behalf into one of these other programs.
Exactly.
Is there portability from state to state in those plans? Or are you limited to the state that you live in, or can you move it? For example, somebody in Rhode Island goes to live in Florida for 4 months of the year. Can they simply take that plan? Do they have to buy a plan that accommodates that change?
That's a lot of questions all rolled up into one. I will say the rules the rules vary state by state. So Rhode Island rules are very different than Mass rules. We tell people, if you're talking to your friend who lives over the border, forget it. Don't just listen to them because the rules are different. So if we get back to open enrollment, so during that open enrollment period, you can make some changes. If you start out making a more conservative approach with traditional Medicare, you can always move to a Med Advantage plan during open enrollment. If you start with a Med Advantage plan and you want to move toward the more traditional side, in Rhode Island, you've got health questions you have to answer. And depending on your ability to answer those, the way the carrier wants to hear them answered may impact your ability to be able to move. You may be stuck in the Med Advantage world. In the Med Advantage world, there's lots of different variations out there. Some of them give you more flexibility to spend extended periods out of state. Others don't give you the flexibility. If you move to another state permanently, that typically creates another opportunity when you're essentially starting from scratch and you can pick what you want.
So if you relocated to Florida as opposed to just being in Rhode Island?
Yes.
Okay.
Right. It's different. It's different. And when we meet with people, the model that we've built, we talk with people about their health, their lifestyle, and their budget. So the number of choices you have is vast. So we would sit with you and say, Bob, tell us about your health. You're a pretty healthy guy. Are you getting any ongoing medical care right now? Are you taking any prescription drugs? Where do you get your care right now? And then we'll ask some harder questions. Bob, if you got a real serious diagnosis tomorrow, would you want the ability to leave Rhode Island? Or are you totally comfortable with the healthcare system in Rhode Island? So that's where we start. And then we move into lifestyle. Are you going to spend the whole year in Rhode Island? Are you going to spend part of the year in Florida? How long is that stay going to be? And then lastly, it's your budget. I mean, we can put you in plans as high as $400 total cost to plans as low as $0 a month once you pay your Part B.
Well, you can see how complicated this really is. And I think that it's important for us to come back to talk about those very clear decisions that have to be made when you're talking to people about health style or lifestyle, health, and budget. So we'll come back in part 2. We'll talk about those things. We'll talk about people living in Massachusetts, getting services in Massachusetts, moving to Florida. This is a very complicated piece, and it deserves another section. So we're hoping you'll come back. We'll do a part 2. Thank you for watching this version of Labor Vision. Thank you for joining us for this edition of Labor Vision. We appreciate your input and encourage your comments. Labor Vision can be seen on this channel 3 times each week: Tuesday at 7 p.m., Thursday at 8 p.m., and Saturday at 5 p.m.